My name is Liz Getz. I'm the Chief Information Officer for Aultman Health Foundation. We're a large health foundation that has multiple hospitals. We have a large hospital that has about 860 beds. We're located in Canton, Ohio. We also have a college, which is called Aultman College for nursing and for allied health. We were really looking for a low-cost solution that would meet the needs of both our hospital-based education and our college-based education. And really the two were very different in ways, but alike. A lot of the college applications did not necessarily meet the hospital needs. We had education for our IT department, which I oversee, new applications, upgrades that come out. We also had safety education across the foundation that we provide for our employees. Any type of education when it comes to nursing or competency. We also had college education that was completely a different field, where they actually had online courses that they wanted to teach over the internet. Training prior to the AMVONET was pretty much, I call it, sitting in a seat. We would have people come to the classroom, we would have a lecture, sometimes we would have a PowerPoint slides, but one of the bigger projects, which was physician order entry that came along when the physicians had to start entering their orders electronically in our systems, we realized that we had such a mass amount of people that had to be trained that we really couldn't do the in-the-seat training anymore because it would take up too much of our time and resources. So we kind of augmented the in-the-seat training with the online training with the physicians and the staff. So we had about 2,500 people that we had to get education to in a very short time frame, and we didn't have enough classroom space to meet those needs. I would say that probably in 2 education for IT, we probably would recoup the cost of 1 FTE because we would have to have an extra trainer in our area just to do the IT training. Also had to be flexible enough that it could be moved around our foundation and used for other needs. So I think, you know, the cost and the flexibility of the system were really the top 2 reasons we chose the AMVONET. I can speak from the hospital perspective. We saved probably thousands and thousands of dollars from having to have educators in our room to teach everything classroom-wise because we didn't have to have the extra education resources on site, and that's only one project. So every project that we have now, we augment the online learning with the actual in-seat learning to give people and some people need actually education ahead of time, or they want to see the subject ahead of time before they come into the classroom. So I think it's not only made it more cost effective for us, but it's made it more efficient for our learners.